The big girls is in a sad situation, a very critical situation for about a year now. See the consequences what we have in Africa about vaccine, big pharma and so on and so forth. She has been destroyed by vaccine. Her brain, her eyes, she's blind. She's not no longer hearing. It's not going very well. I have the privilege to have a family with me here. Explain in few seconds what happened to the big girls.
Okay.
And for how long now?
Here is my wife and here is my daughter. Since on the 13th of April 2023, my wife took this child to a hospital in Kribi in Cameroon for a yellow fever vaccination, a normal immunization program. So immediately she was vaccinated now, cardiac arrest, her heart stopped beating, and that one led to her brain damage after a few months of treatment in the hospital. So since that time now, this child lost her sight. She can no longer see. As you can see now, her head cannot even position. She cannot make use of these her limbs. She cannot walk. She cannot sit down. She cannot do anything. This is already 1 year plus now. Up to this moment, Cameroon government abandoned this child. They don't care whether this child lives or she died. We were opportune to travel to India. Since we came back from India, we have not heard anything from the government. We have been crying on this innocent baby. So today now, we happen to be with Reverend Frankie Yemga and the wife here. So this is us here. As you can see, this is the child situation.
As the mother of the child, how have you been managing for a year? Your child is like a dead leaf now. How do you manage? She's crying almost every minute.
It has really been a frustrating journey for me. Even as I am talking now, I am so frustrated. Whenever I look at Grace, tears roll down my eyes. My heart beats for her because I'm wondering what is she going to become in future. When the doctors are telling me that the brain damage, there is no cure for it. So I don't just know her future. I'm so worried about.
Pharmaceutical industries in Africa. This video is actually for you because I listened to the video of the pain of this family. They took their daughter in the month of April for an immunization, yellow fever immunization precisely in Cameroon. And the child is made a vegetable. Mothers, please come close. Mothers, please, whenever you go for immunization, no matter the name of the immunization, please endeavor to ask the doctor what is given to your child, because I find this strange. And the parents are saying the pharmaceutical industries in Africa are doing this to babies. And this is a call out to our presidents in West Africa, especially West Africa. West Africa, please, the drugs they are bringing to Africa, please, let's be checking them. The drugs people are using in Africa, let us try as much as possible. Check these drugs. Because the parents are saying, allegedly, that these drugs is doing more harm to the children. That child is just a vegetable because of the carelessness of some pharmaceutical industries bringing drugs to Africa. Our government, what are you doing? You have regulatory bodies in West Africa. This is not Nigeria, this is Cameroon. But I was pained because this is a child. A child is involved. And a child's life matters. An African child's life matters. Our presidents, this is a wake-up call for every company, everybody in charge of drugs regulation in Africa. We all need to wake up because it's affecting our future generation. We all know that our children is our future. What is our gain if we eliminate our own children? Then our labor force will be depleted because that is our pride as Africans. Government, let's try as much as possible. Government agencies in charge of regulation of this product that they bring to Africa, please, let us a wake-up call for everyone to sit up, know the kind of drugs that are being imported and that are given to children as immunization. Let us all wake up. Let's do our duties. Anywhere we are placed, let's do our duties. Let's open our eyes because no one will do the duty for us. The people you people are looking at, they don't have good thoughts for Africans. They don't have good mind. Their thought is to eliminate us. But how can we use our own hands to kill our own children? let us be very, very mindful the kind of products we give to this young one. Mothers, when you go for immunization, ask questions. What are you giving to him? What is the name? Google it if needs be. Check the implication on that child. Look at the expiring date. Be very careful what someone gives to your child. This is a wake-up message. Please share this message to those that are concerned, to those that are in charge of these bodies that bring these drugs to Africa, West Africa in particular, because I feel the pain of these couples. Thank you for watching. Please tag them.